Despite its low-risk status and a relatively much better overall pandemic response than America, the Philippines has been tagged and relegated to a level 3 high-risk country for U.S. travelers and tourists. What constitutes this latest CDC level 3 designation or high-risk classification, our Mark Vitalco explains in this report.
The U.S. Centers for Disease Control and Prevention included the Philippines in the list of countries considered as high risk for COVID-19. In a travel advisory released by the U.S. CDC, the Philippines is at level 3 when it comes to COVID-19 based on the number of people who are testing positive for COVID for every 100,000 population. The U.S. CDC advised travelers to make sure they are up to date with their COVID-19 vaccines before visiting the Philippines. In addition, it said people who have weak immune system or are at high risk for severe disease should consider delaying travel to the country. Also under the high-risk countries are Nepal and Russia. The Department of Health said they are basing the country's risk level on the healthcare utilization rate as compared to the US CDC that uses the number of new COVID-19 infections.
In terms of this risk classification of US CDC, it talks about the number of cases and the number of those testing positive. But we need to further go deep and analyze this. Ilan ba dyan sa sinasabi nila na naging high risk tayo ay severe at critical?
Based on the COVID tracker of the DOH, the Philippines logged over 2,000 new COVID-19 cases yesterday, compared to over 4,000 recorded in previous days. The tally of active cases nationwide also declined slightly to over 36,000. According to the Private Hospitals Association of the Philippines, the number of severe and critical COVID-19 admissions remains manageable at this time.
Right now, hindi pa kailangan sa tingin namin because of the utilization. Unless biglang sabihin na ayan, nagpupunuan na naman siguro mga hospitals because of COVID. Yung talagang But then, sa tingin namin, it's still manageable. So, there's no need palagay ko na mag-raise ng alert level so far.
Meanwhile, the Opta research said the daily positivity rate in the NCR has been trending down since the first week of August, while in Cebu City, new COVID cases have been on a 2-week decline since its peak on July 31. Mark Vitalco for The Nation.